So, Dr. Mena, talk to us what happens exactly as we age and what happens to those discs based on this graphic that we have.
Okay, so the one on top basically is a normal disc. And that will be how most of us, when we were in the teenager years, how those discs they look like. As we start aging, normally it will become more of a degenerated disc, bulging disc, or a thinning disc. The terminology of a bulging disc is not the same as a herniated disc.
Right.
It used to be used in the past interchangeably with a herniated disc, but in the early 2000s, there was a consensus among the radiologists in defining a bulging disc versus a herniated disc. Bulging disc, by definition, doesn't cause pain. It's just that the disc is a little more lax, and it's just a matter of degeneration. So basically, number one, number two, 3 and 4, they can coexist, but all of those, since the disc is weaker, they can lead into having a herniated disc, which basically is a focal area of the disc that slips out and come out from the spaces in between bones. Sometimes it can touch a nerve and develop the symptoms going down the leg, or sometimes can cause pain by itself in the lower back.
So, Claudia, when patients come into the office and they see you and they see Dr. Mena, what is their complaint in terms of pain?
Most of the times the pain can be sharp. Sometimes they'll say that it's stabbing. Sometimes they'll say it's burning. And usually when they're talking about burning pain, it's more related to the nerves, that there's impingement of the nerves. When it's sharp, when, like you were saying, when it's sciatica, that's more impingement of the nerve. Right. Also, you know, and the patients, again, we treat them, the mainstay, with anti-inflammatory, steroids sometimes, depending if the pain is acute, if it's within maybe a month. Sometimes, you know, once the pain subsides, again, we go back to the rehabilitation and getting their core strengthened with physical therapy, stretching and strengthening exercise. And the most important thing we tell our patients is, like the gentleman was saying, you don't want to do something just in physical therapy, but you want to continue this long term and doing exercises at home.